Hi, my name is Donna Winterberry, and this is the physical assessment. The subsystem number 1 is what I chose for my project. Here is my ID card. Also, my patient is Mr. Darren Winterberry. Mr. Winterberry, do you give permission for us to use your video and to place it on YouTube?
Yes.
Thank you very much. So, Mr. Winterberry is a 54-year-old male. His occupation is a credit analyst. He appears his stated age, his level of consciousness. I did ask him, do you know where you are?
Yes.
Do you know who the president is?
Yes.
Thank you. Who is the president?
Donald Trump.
Okay, wonderful. I did look at his skin initially when he walked in, and he is pretty reddened. And I asked him if perhaps he'd been out in the sun, and he stated yes. His nutritional status seems quite normal. His posture is up and erect. I don't notice any obvious physical deformities. His mobility is good. He's able to walk on his own, no involuntary movements. His facial expression is that of calm, normal. His mood and affect is good, generally in good spirits. His speech is normal as well. He articulates well. And looking at his personal hygiene, he looks well groomed. There doesn't appear to be any remarkable things about that. He weighs 182 pounds. He's 5'10", and his body mass index is 27, which is within normal range. So first, I would like to mention that initially when he walked in, we did a Snellen test to test his vision, and he was pretty accurate according to his optometrist too as well. I checked his radial pulse. It was at 82. His respirations were 14. His blood pressure is 130/85, and his temperature is 97.7. There is no pain that he reports. Generally in good health, this patient is. When inspection upon his skin, I did notice by looking at his hands that they are pretty red. I was checking for the temperature, moisture, the texture. I checked the turgor, and it all appears normal. However, I do notice that he does have several areas of scratches, and it looks like teeth marks. And when I asked the patient about this, he had mentioned that he'd been roughhousing with his new puppy. So that would probably explain the multiple small lacerations on his forearms. Okay? So we looked at temperature, moisture, texture, and turgor of his skin on his hands. His nails appear normal. They are a little long, and as I'm checking his capillary reflex, they all seem to appear normal. And his fingernails, there's no cracking or pitting or any signs of any kind of fungus, and they're pretty well maintained. Thank you. Now, before I continue, Mr. Winterberry, I gave them a brief background of what we had done initially before the video. I am now going to continue to inspect and look at your head, and I will let you know as I'm going, okay? All right, so first I'm going to take a look at your scalp, hair, and cranial, okay? I'm taking a look at his hair, appears normal. His scalp, I'm looking for lesions, any bumps, lumps, anything that stick out to me, and they all appear normal. Symmetry is good as well. Okay, Mr. Winterberry, I'm going to also palpate, or I'm going to push on your face and check your sinuses, okay? So I'm going to go around check your sinuses. Would you please let me know if you feel any tenderness at all? Okay. I'm also going to check the temporal artery. And I'm going to move down to the temporomandibular joint. Can you open and close for me? One more time. Okay. Any issues there at all, Mr. Winterberry? Okay. That all feels great. The patient did not complain. Now, I'm also going to check for his eyes, any abnormalities there, and I'm going to check his visual field. So, Mr. Winterberry, I'm just going to have you face forward. I'm going to cover this eye, and let me know if you can see the side.
Yes.
Okay, and then how about this side?
Yes.
As well? Great. Okay, put this down. I'm also going to check the muscles of the eye, the extraocular muscles. So if you could please follow my pen. I'm going to move it in this direction and just follow it with your eyes. I'm going to give him 6 points to look at. Very nice. I'm also going to pretend that this is a pen light, which I'm going to check for his external structures. Going to take a look at that. And then we're also going to check for his pupil reflexes as well. Okay, so eyelids look good. I'm going to check his sclera, his cornea, his iris. All looks great. Okay, so in order to check his pupil reflexes, I'm going to place the pen light in his eye and check to make sure that both pupils are reacting normally. Wonderful. Now, I would also darken the room at this point, and I would use an ophthalmoscope to look at the red reflex. Take a look at his ocular fundus, his disc, his vessels, and the retinal background and macula to see. So I would like to simulate that the lights have dimmed, and I'm going to very carefully look and see if I see any redness, inflammation, any kind of lesions. Check both eyes. Okay. I'm also going to check for accommodation. If you could, Mr. Winterberry, just follow my pen. Okay, great. Thank you. Now, I would like to look at your ears, if that's okay. I'm going to check his external ear. I'm going to check both sides. Okay, I'm going to pull down. Please, Mr. Winterberry, let me know if you find that any of these things that I'm doing produces any kind of pain or tenderness. I'm going to push down on the tragus. Okay. Now, what I'm going to do is just test your hearing. If you could, I'm going to whisper something into your right ear, and we're going to close your left ear, and you're going to repeat what I say, okay? All right, here we go.
Monday.
Thank you. And we do this side as well.
Sunday.
Thank you. Did you have any problems hearing at all, or did you feel like you were struggling to hear those sounds? No. Okay, thank you. So now I'm going to take an otoscope, and I'm going to look inside the ear. Pretend to look inside the ear. And I'm looking for a pearl gray appearance of the tympanic membrane. Also the position, I'm going to check the landmarks also as well. And if I had a tuning fork, I could vibrate it, and I would place it on his forehead and check to see if he could hear that. I could also place it at his mastoid process, a tuning fork, and see if he could hear that. And then also here behind the ear checking to see if his bone is conducting the vibrations to help him hear. Okay, now I would like to turn my attention to your external nose. I'm checking for symmetry, which it looks great. I'm going to check the patency of his nares. So, Mr. Winterberry, I'm just push down on this right nair. If you can give me a little sniff. Sniff. Good. And then about the other side. Sniff. Any issues with that at all?
No.
Okay. So now I'm going to take my imaginary otoscope and, I'm sorry, not the otoscope, excuse me. The speculum. And I'm going to look inside the nares. I'm going to look at the nasal mucosa. And I'm going to look at the nasal septum. And I'm also going to look at the turbinates as well. And all appear to be normal. Now I would like to check his mouth and throat. At this point, I would wash my hands and I would don gloves and I would check inside his mouth. So here, I'm going to ask Mr. Winterberry to open your mouth. And I'm going to look at his tongue, his cheeks, his hard and soft palate, which all appeared normal. Can you say ah?
Ah.
I'm going to check for his gag reflex as well. I'm going to place the tongue blade in and give me a gag reflex.
Ah.
Good. So I would say his tonsils are at a 4. His uvula is mobile as well. And I do not see any other abnormalities. So the tongue looks good. Cheeks, buccal mucosa, the teeth appear normal. No obvious decay. Okay, as well. And he could stick out his tongue, so cranial nerve number 12 is doing fine. And he also has that mobility with his uvula, and that takes care of cranial 9 and 10. Okay, his neck also looks symmetrical. And Mr. Winterberry, I'm now going to palpate the nodes around all your neck area, okay? So I'm going to start off coming here, and I'm going to palpate here, checking for those nodes. Okay, and then in the back. Okay, I'm going to follow to the occipital nodes. Okay, I'm going to have you turn to the right for me, and I'm going to palpate this cervical chain here. Turn to the left. I'm going to palpate here too as well. Please let me know if you're finding any kind of tenderness, okay? I'm also going to check if you could turn front, the submandibular, excuse me, and the submental. So prearticular, postarticular, occipital, okay? And then I'm also going to go ahead and check the subclavicular nodes as well. Are you feeling any tenderness there at all?
No.
Okay, thank you. So as far as the neck, the mouth and the throat go, looks fine. I didn't notice any issues. The neck is also symmetrical. I did not see any lumps, but I'm doing an inspection to look for pulsations as well. I went ahead and palpated the nodes. I also am going to check his carotid pulse. And I'm going to check on each side separately. And I'm also going to try and look for bruits too as well. I'm going to go ahead and listen. I do not have a bell on this particular stethoscope, but it is electronic, and I switch it this way to the bell, okay? I'm going to listen. Checking for bruits, thrills as well, okay? I'm also going to palpate his trachea, one side at a time. Okay, take a look at your trachea. It is in the midline. There are no obvious enlargements there at all. Can you turn to the right for me? Any issues there? Can you turn to the left for me? Good. How about head down? Good. And head back. Nice. Any issues there at all?
No.
I'm going to check your strength too now. Press against me to the right. Good. And then press against me to the left. Good. Press against me forward. Okay. And then now back. Perfect. Appears very strong. No issues there. I'm going to simulate checking his thyroid gland as he's drinking water. So I'm going to pretend to give him a glass of water. And so what will happen is I'm going to give you a glass of water. You're going to hold it in your mouth. And when I say swallow, you swallow. And while he's swallowing, I'm going to palpate to see if there's any abnormality there. Okay? Now, I'm going to take a look at the chest and the lungs, both posterior and lateral. So I'm going to have you stand up at this point, if you could. And I'm going to move this out of your way. If you could put your back towards the camera for me. Okay, so I'm going to take a look at this thoracic cage here, configuration. I'm looking at the skin characteristics, which there is some reddened areas here also, okay? And then I'm also going to palpate. Please let me know if you're finding that any of this is causing you any pain at all. Okay, so I'm also going to listen for tactile frenitus. Okay, can you say 99?
99.
99.
99.
99.
99.
99.
99.
Okay. Now, along with this, we're going to go ahead and check his chest expansion and make sure it is also symmetrical. And then we're going to palpate his spinous process. So can you take a deep breath for me? And exhale. One more time. Good. Exhale. Seems symmetrical. I'm going to go down his spinous process and palpate there and see if there's any issues at all. Let me know, Mr. Winterberry, if you're feeling any type of tenderness at all. Am I hurting you? No?
No.
Feels okay? Okay. I'm also gonna percuss, which means I'm gonna just lightly tap your back, okay? And I'm listening for some sounds. And I'm also going to listen for any breath sounds that may not appear normal. Any adventitious sounds. Okay. Can you take a deep breath for me? Good. Exhale. Deep breath. Exhale. Deep breath. Exhale. Okay. And then I want you to breathe normally now. Deep breath. Good. Deep breath. Deep breath. And deep breath. Thank you, Mr. Winterberry. All right, I believe you can go ahead and have a seat. Let me fix your bottom here. So earlier we talked about his respirations, which were normal. Again, I'm going to check for lumps, bumps, things that don't belong here. Okay. Can you say 99?
99.
99.
99.
Good. 99.
99.
99.
99.
Okay. So chest and lungs appear normal. I'm also going to do breath sounds there as well. Take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Okay. So his breath sounds appear normal as well. We're going to go ahead and take a look at his range of motion and muscle strength of his upper extremities. Okay. So let's see here. What I need to do is go ahead and if you could raise your arms up this way and push up against me. Good. And then push down. Okay. Can you put your hands behind your back? Good. Any problems with this at all?
No.
Okay. I'm going to check his nose. You can relax now. All right. I'm also going to check his epitrochlear nodes too as well. Okay. Both sides. Any tenderness up there? Okay. So I'm going to simulate that. I'm going to put the patient back at 30 degrees. If you can lean back for me. I'm looking at the symmetry of his jugular neck and I'm checking his neck veins as well. Okay. And all appear to be normal. And check his pulse, which we did earlier as well. Check the other side also. You feeling any kind of pain or swelling there?
No.
Okay, thank you. So now we're going to take a look and listen to the next system, which is the procardium pulsations, and we're going to look for heaves. We're going to listen to the apical pulse. Right here. Very nice and healthy. Okay, now we're going to go ahead and take a listen to all the heart sounds, starting at the apex, moving my way, inching my way up to the base. Pulse is nice and regular. I'm also at this time going to ask him to, well, we'll simulate this, to lean to his left side. You know, I'll put him on a table and have him lean to his left side, and then that way I can also again listen to his heart as well. So this concludes my assessment of Mr. Winterberry. His vital signs are normal. He isn't complaining of any pain. I did not find any abnormalities that stuck out aside from His skin, which he does have several lesions, which he says is from his new puppy that he has found. And he does have a little bit of redness. And at this point, I would probably counsel him on using some sunscreen. And that is it. Thank you.